I'm Gaelyn Garett. I am the service line chief or division chief of laryngology here at Vanderbilt in the Department of Otolaryngology, head and neck surgery.
So I'm Kimberly Vinson. I'm an associate professor, laryngologist here at the Vanderbilt Department of Otolaryngology, head and neck surgery.
The laryngology service here at Vanderbilt, we have 4 full-time MD faculty, and it's one of the larger programs in the country. All of us are laryngology trained. Every one of us did our fellowship. Every one of us did it actually here with different mentoring. We all are now full-time laryngologists. That's all we do, and I think that's fairly unique, but we all also kind of overlap in our specialty interests.
So one of our partners, Dr. Chuck Fletcher, who also did his training here, like Dr. Garett said earlier, left following his fellowship training here to go do more of a private practice laryngology experience and was able to rejoin us, I guess, a couple of years ago. And it's just brought back different techniques, which has been fun and exciting for us, specifically in office vocal cord injections, which has been really neat. And so to have a former fellow be able to come back, having developed something interesting and new, and be able to teach us all has been really a great asset to have.
What's interesting, if you look at our colleagues, one in particular had a special interest in doing airway work even during his fellowship, and that's Dr. Alex Gelbard. And Dr. Gelbard did his fellowship, but during that year was probably one of the most prolific researchers that we've had. He has been able to formulate a multi-institutional research collaborative specifically for idiopathic subglottic stenosis, among other airway diseases. And we're now a destination place for complex airway reconstruction. And that's probably been over the last 5 years.
I really knew that I wanted to come back here to train because I felt that this was the #1 laryngology program in the country. The joke in our clinic is that everyone here in Nashville is a singer-songwriter. And so it is also really cool to be able to take care of patients who have come to Nashville to try to break into the music industry and become the next big thing. While it may be the home of country music, it's also the home of pop and rock and indie and folk and Americana and gospel and blues and almost any genre that you can imagine. And so it's the perfect place for us to be able to help our patients. I think that when people think about voice in Nashville, they do think about the singers and the musicians, but it's really more than that. It's the songwriters as well, it's the teachers, the preachers, the lawyers, and so we really have, I think, the most wonderful patient population to be able to work here, and it's just a wonderful backdrop. Nashville is a wonderful backdrop for us to be able to do the work that we do.
What's unique about it is its multidisciplinary approach to taking care of voice, airway, and swallow disorders. And with that, we have a strong team of speech-language pathologists who, each one of them has done a fellowship in voice through their programs, and they all have various backgrounds. 2 of those speech pathologists are actually on our faculty, and the others are staff speech pathologists, and they are with us every day in the clinic. And what's really special is it's a team. So when we see patients in the clinic, it's not just the physician. It is the physician, the speech-language pathologist, singing specialist. And so we have that essentially as a one-stop shop